Question number 6. How much does eye surgery cost? Like all things, it depends. It depends on what we find during your eye exam and how you want your vision corrected. But let me give you a general idea of the cost of 5 of our most commonly performed procedures that we offer to help people see better, ideally without glasses or contact lenses. On this chart, which we update on our website, austineye.com, on the second to bottom row is the patient charge per eye for premium lens replacement for the various premium lens implants that we use. If you're having premium lens replacement surgery, then you don't really have a visually significant cataract, and therefore insurance is not used to cover any of the costs of cataract surgery. The patient is fully responsible for paying out of pocket for the charges for elective premium lens replacement. Now, on the bottom row, that is the charge to the patient per eye for situations where the patient has medical insurance and they have a visually significant cataract and they want to have a premium lens implant. The cost structure for this category of patients is less than the cost structure for patients that are having purely elective premium lens replacement. For basic cataract surgery, if you have medical insurance that we accept, then your out-of-pocket expense per eye is your copayment and unmet deductible. If you're choosing to have basic cataract surgery with a monofocal lens and you don't have any insurance, then the cost is about $4,555 per eye. If you've already had lens implant surgery elsewhere and you come to see us and you end up undergoing intraocular lens exchange, also known as IOLX surgery, where we remove your existing lens implant and replace it with a different premium lens implant, then the cost per eye is $10,000. If you're going to have intraocular lens exchange, you've had your lens implant placed at a outside practice and we remove that implant and replace it with a basic monofocal implant, then that service is generally billed to your medical insurance. So your out-of-pocket expenses, your unmet copayment and deductible. Finally, if you're interested in having your vision corrected with LASIK surgery, then our charge is about $2,800 per eye for a customized wavefront guided all laser LASIK procedure. During your eye exam in our office, we'll be able to give you a very specific quote on what your out-of-pocket expenses will be for any eye surgery that you choose to have, and if your insurance can help cover some of the costs of your eye exam or your eye surgery.